Let's see an NCLEX RN video based on care for patients with intestinal disorders. The nurse is caring for a post-operative patient who has had surgery for hemorrhoids. What information should be taught to the patient in the post-operative period? Apply dry heat to the surgical area as soon as you return home. Maintain a low fiber diet. Contact the provider if urinary retention occurs. No bowel movement is expected for 3 days. Urinary retention may occur because of rectal spasm and pain. The nurse needs to make sure the patient has urinated prior to leaving the outpatient facility. Patient also need to be taught to call the physician immediately if they are unable to urinate once they return home. The nurse is caring for a post-operative patient who has had a surgery for ventral hernial repair. The nurse is reinforcing post-operative care teaching and asks the patient to verbalize what was taught to him. Which statement requires the nurse to clarify the patient's perception of the teaching? I should turn, cough and deep breathe every 2 hours. I should avoid lifting heavy objects until my provider tells me that I can lift again. I can use ice packs and scrotal support for scrotal swelling. I will observe my incision for redness, heat, swelling and drainage. I will report these signs to my provider at once. So here clarification is required when the patient says, I should turn, cough and deep breathe every 2 hours. Coughing will cause undue pressure on the surgical site and possibly it can lead to recurrence of the hernia. If coughing is necessary, the surgical site should be splinted with pillows to prevent pressure on the site. An 80-year-old patient is admitted to the hospital for diverticulitis. The family states that the family member isn't acting normally. The patient does not have specific complaints. The nurse correlates this data to which characteristics of older adults. They typically complain of a lot of pain with diverticulitis. They often have referred pain to another site. They may exhibit a change in mental status before any other symptoms occur. They will be having other symptoms such as nausea and vomiting. The first sign that may appear in the elderly is a change in the mental status. Baseline temperature is often decreased from normal in older adults. Therefore, one of the most common signs of infection may not be apparent in an older adult, and the patient may present with increased confusion, falling, and anorexia. The nurse is caring for a patient who has had surgery for colon cancer and has a permanent colostomy. Which assessment must the nurse report to the provider immediately? The stoma is reddish pink and moist. The stoma is flat against the skin. The stoma has not expelled any flatus or stool in the first 24 hours. The stoma is dark and bluish in appearance. If the stoma begins to show signs of ischemia, that means dark red, purplish or black or blue in color, or unusual bleeding, the physician should be notified immediately. This is a sign that there is little or no blood flow to the stoma. The patient with which condition is at highest risk for fistula formations? Crohn's disease, ulcerative colitis, diverticulitis, irritable bowel syndrome. Crohn's disease is transmural, affecting all layers of the bowel. It can develop certain sinus tracts leading to fistula formation. The nurse correlates strangulated hernia to which finding? Impede blood flow to the intestines, result from pressure on an old surgical incision, lead to bouts of diarrhea, a hernia in which contents can be placed back into place. When the intestine protruding through an abnormal opening cannot be placed easily back into the abdominal cavity, manually or by lying down, it is known as irreducible or incarcerated. If the blood supply is obstructed, it is then known as a strangulated hernia and the patient may present with symptoms of an intestinal obstruction. This is a medical emergency and the patient must be prepared for surgery immediately to prevent gangrene from developing. Diarrhea is not a clinical manifestation of strangulated hernias. Clinical manifestations include abdominal distension, nausea, vomiting, pain, fever, and tachycardia. So, strangulated hernias impede blood flow of the intestines. Which interventions are considered conservative treatments for hemorrhoids? Hemorrhoid creams and ointments, sitz bath, over-the-counter analgesics, cryosurgery, rubber band ligation. Treatment of hemorrhoids is usually conservative and involves relief of symptoms and associated pain. Cold packs and sitz bath, that is warm water baths covering the hips and buttocks 3 or 4 times a day, reduce some swelling and pain. There are a number of over-the-counter preparations available in creams and suppositories used to treat the hemorrhoids. Rubber band ligation and cryosurgery are surgical interventions for higher grade hemorrhoids. So here hemorrhoid creams and ointments are there, sitz bath is there, and over-the-counter analgesics. They are the conservative treatment for hemorrhoids. The nurse recognizes which finding as diagnostic for irritable bowel syndrome. ROM4 and or Manning criteria. CT scan of the abdomen shows inflammatory process. Blood urea, nitrogen and creatinine are elevated. Patient has abdominal pain and psychiatric diagnosis. There are two tools used for the diagnosis of irritable bowel syndrome, that is the ROM4 criteria and also the Manning criteria. So this ROM4 diagnostic criteria is for functional gastrointestinal disorders and the Manning criteria is for the diagnosis of irritable bowel syndrome. The other tests which are given may be used but are not as specific. A patient is admitted to the hospital for treatment for diverticulitis. The nurse recognizes which interventions appropriate for this patient. High fiber diet, ambulate frequently, IV fluids, pain medications, antibiotics, IV fluids, NPO, NG tube pain medications, laxatives, enemas, diet, pain medications, surgery with follow-up physical therapy. Patients with diverticulitis who are hospitalized are treated with broad-spectrum antibiotics, IV fluids, placed on NPO to allow the bowel to rest. The patient may have an NG tube for bowel decompression. Laxatives and enemas should be avoided because they increase the intestinal motility. Pain medications may be given as needed and opiates are frequently needed. If patients develop complications such as perforation, hemorrhage, obstruction or abscess, they may request surgery to remove the diseased portion of the colon. So here antibiotics, IV fluids, NPO, NG tube and pain medications. The nurse is caring for a patient in the emergency department with abdominal pain, fever, nausea and vomiting. The patient is suspected of having appendicitis. What intervention may the provider order to confirm the diagnosis? Flat plate X-ray of the abdomen, chemistry panel, CT scan, CBC, abdominal assessment for rebound tenderness, administer a laxative to see if symptoms improve, colonoscopy, esophagogastroduodenoscopy and endoscopic retrograde cholangiopancreatograph, ERCP. So here, in patients with appendicitis, as the inflammatory process proceeds, pain is shifted to the right lower quadrant of the abdomen and becomes more severe and steady in an area of McBurney's point. When applying and releasing pressure to this area, if the patient notes increased pain when pressure is released, this is called rebound tenderness and is another indication of appendicitis. An abdominal CT may indicate inflammation or enlargement of the appendix. While a flat plate X-ray of the abdomen and serum chemistries may be ordered, they are diagnostically definitive. Laxatives are contraindicated due to the risk of perforation. There is no indication of colonoscopy, EGD or ERCP in patients with appendicitis. So here the provider should go for CT scan, complete blood count and abdominal assessment for rebound tenderness. The nurse is caring for a patient with colorectal cancer who just had a total colectomy with placement of a permanent ileostomy. Which nursing diagnosis is a priority for the immediate postoperative period? Disturbed body image, acute pain, potential for infection, knowledge deficit. Adequate pain management is necessary for the patient to return to an optimal level of functioning and to prevent postoperative complications such as atelectasis. The other nursing diagnoses are relevant, but acute pain is the priority in the immediate postoperative period. A patient has just been brought to the emergency department by emergency medical services after a motor vehicle accident. What is the first thing the nurse should do? Ask the patient if he or she is in pain, mental status examination and vital signs. Ask the patient to move all extremities, order laboratory test. Once the trauma, patient's airway, breathing and circulation have been thoroughly assessed, then the patient needs to be evaluated for the signs of hemorrhage, shock and peritonitis. Vital signs and mental status examination are priority nursing interventions. The nursing clinical manifestations vary widely according to the organ of injury, and assessment includes the presence, location and quality of any pain experienced by the patient. So Mr. Jack, a 17-year-old male, has been experiencing abdominal pain and has recently noticed blood in his stool. He presents to his primary care provider with complaints of abdominal pain and bloody stools, 12 to 14 stools per day. He described that he has been having bright red blood in his stools for 6 months with abdominal pain that began shortly thereafter. On examination, abdominal pain is diffuse in location and sharp in character. A stool sample reveals the watery consistency with blood streaks and pus or droplets of fat floating on top of the stool, along with spasm of the anal sphincter and persistent desire to empty the bowel. The colonoscopy shows that Jack has multiple ulcerative lesions in the descending colon. His upper GI tract endoscopy is negative. The wireless capsule endoscopy is negative. His vital signs are temperature 100.5 degree Fahrenheit, pulse is 133, respiratory rate 24, blood pressure 120/75 mmHg, pain score is 7 by 10 in a scale of 10. His weight is 62 kg and his height is 165.5 cm. His hemoglobin is 7.6 gram per deciliter and his hematocrit is 21.2%. Jack's diagnosis is ulcerative colitis. Jack undergoes surgery for his ulcerative colitis. He had the first of the two surgeries, colectomy, mucosal proctectomy, and ileal pouch anal canal anastomosis. Jack has a temporary ileostomy. He will return to the hospital in 2 to 3 months to have the ileostomy reversed. What clinical manifestations does Jack display that are consistent with the diagnosis of ulcerative colitis? Bloody stools, constipation, belching, chest pain, and dysphagia. The stools of the patient with ulcerative colitis is usually watery diarrhea with blood in stool. So, bloody stools will be there. Constipation is associated with disorders that slow GI motility such as opioids. Belching is usually associated with disorders of the upper GI system, and chest pain is associated with GERD and hiatal hernias. What diagnostic test does the nurse expect to be ordered for Jack on the basis of the symptoms? CBC, MRI, electrolyte stool analysis, CT scan, MRI, chemistry panel, ERCP, colonoscopy, CBC, wireless capsule endoscopy, upper GI endoscopy, BUN, creatinine, ultrasound, chest X-ray. All of these, if you see, bloody stools are more common with ulcerative colitis. Therefore, a CBC should be ordered. Then what you need to do is wireless capsule endoscopy evaluates the portion between what can be seen with the upper GI endoscopy and the colonoscopy. Ulcerative colitis affects only the large intestine, but Crohn's disease affects anywhere from mouth to anus and must be ruled out before a surgical decision can be made. Blood, mucus and pus are common with ulcerative colitis but is not with Crohn's disease. So here the provider should go for a colonoscopy, CBC, wireless capsule endoscopy as well as upper GI endoscopy. What other priority information may the nurse assess in order to care for Jack? Psychosocial history, family history, vital signs, previous bowel history, vaccine history, medication history, heart rate, orientation status, ability to participate in sports, blood pressure, cranial nerve sensation, skin assessment. All of these are important assessment for the nurse. However, irritable bowel syndrome often shows a familial tendency and it must be noted whether there is any family history. Psychosocial history is important as irritable bowel syndrome disorder patients often have many psychosocial issues and symptoms are exacerbated during stress. Vital signs are important as during the inflammatory process the patient if often will be febrile. The patient's previous bowel history is used to determine the onset. So the first one, that is psychosocial history, family history, vital signs and previous bowel history are important assessments. Which information did the nurse include in teaching to Jack related to his diagnosis of ulcerative colitis? Decrease fluid intake to decrease diarrhea. Spread out your meals to 6 times per day. Avoid foods high in potassium. Increase your intake of simple sugars for energy. The patient is encouraged to eat small frequent meals in order to decrease the gastric motility and decrease diarrhea. The patient is at risk for fluid volume deficit, so fluids are not decreased. Loss of potassium may be increased with diarrhea and may require supplementation. Simple sugars increase the gastric motility and can exacerbate this diarrhea. So here we need to tell spread out your meals to 6 times per day. On the basis of the above information, what will the nurse consider the priority to notify the provider? Height and weight, temperature, blood pressure, hemoglobin and hematocrit. Jack's hemoglobin is 7.6 and hematocrit is 21.2. This probably accounts for the pulse of 133. His weight is on the low end of normal for his height but not a priority of care. His temperature is 100.5 degree Fahrenheit due to the inflammatory process and body's immune system at work. The blood pressure is of no concern. The nurse should expect the physician to address the potential of the Jack to receive blood products for his hemoglobin and hematocrit. So that is the important thing which need to be notified to the provider. Hope you understood this video. Thank you. Please do keep watching.